Hello, everyone, and welcome back to Automation Days 2022. I'm super excited to introduce our next speaker, Dr. Mazin Gadir. Dr. Mazin is going to talk to us today around hyperautomation in healthcare, the good, the bad, and he very adequately called it the future. Dr. Mazin is a health informatics futurist, quantum physicist, startup mentoring coach, and inspiring international keynote speaker, whom I literally live have seen a couple of times. He has a very deep understanding around health and technology, and he's a Web3 ambassador who loves everything about blockchain, the metaverse, NFTs, nanotechnology, and big data. Today is going to be Dr. Mazin's first time speaking at Automation Days, so I'm going to be extremely happy to welcome him here today. Dr. Mazin, it's an absolute pleasure to have you be part of Automation Days today. I understand you're presenting today from Dubai, right?
That is correct. Yes, absolutely. Can you?
Good, the floor is yours.
Thank you, Jan. Much appreciated. It's always a pleasure to share the virtual podium with you and hopefully see you very soon in Dubai and share physical podiums and stages with you. Thank you for the introduction. I really appreciate it. I think the the one word that I could summarize uh, my fortune being in this industry is that being a long life student, learning continuously, is one of the things that I enjoy doing a lot. And again, thank you for the invitation to be presenting in front of you today, all the way from Dubai. Today, we definitely I want to show you a bit of the fun activities that we are having in this part of the world, specifically in an industry that is as complex as healthcare. And that's why I thought of this title. I'm a big fan of one of the old cowboy movies, right? The good, the bad, and the ugly. Clint Eastwood, I remember that. So that was one of the titles that stuck with me. And I thought, let me share with you something similar. And basically, what I'd like to do is give you a bit of a taste of some of the adventures we had in the last 14 years. I've been in digital health for almost 22 years. My first 9 years in digital health has been in the UK, and mostly working very closely with the NHS, the National Health Services. We're also looking at automation and digitization in healthcare in countries like France and Spain. So again, moving to Dubai, where I grew up actually in 2009, to work heavily on digitizing healthcare across this region, Africa, Middle East, South Asia, with huge focus on the GCC countries, the Gulf Corporation countries, and that includes the Saudi Arabia, UAE, Kuwait, Qatar, Oman, and Bahrain. So, just to give you a bit of introduction about who I am, again, a long life student. I've done um, um, a lot of learning actually in the area of digital health from different angles, from the private sector, the regulator. I started my career in digital or in healthcare in academia. My research was actually on infrared imaging and quantum infrared photo detectors for cancer detection. I'm an electronics electrical engineer by background, but found myself all of a sudden doing a research project in digital and healthcare specifically, and that brought me into digital space. I worked in a number of different organizations, the likes of Cerner, PwC, IQVIA, where I currently serve in the latter one, as the partnership and strategic alliances. I also advise Dubai Health Authority and a number of other authorities and ministries in the region. So, as a disclaimer, these slides I've prepared them from my own point of view. I'm not representing any institution or organization. I only represent my expertise and what I've learned so far in the last 22 years in digital health. And how is that related to hyper automation? Because that is a big part of what we've been doing in the digitization of healthcare. So today I thought I'll give you a bit of perspective about the digital health sector and how is that related to our region, because I just want to give you Asia has been doing a lot of work from West Asia East Asia, Southeast Asia. There's been a lot of work in the digital health space, and some of the most recent conferences in digital health was actually, I believe it was in Indonesia. It was about the Health Information Management System Society that shows the importance of digitization of healthcare, where Singapore, Malaysia, countries like Indonesia, Philippines, even South Asia, something like India, Sri Lanka have been pushing the envelope of digitizing healthcare and hence bringing more and more automation. We'll talk about the healthcare sectors quickly on the UAE. I'm going to give you a couple of kind of sector examples. Healthcare in UAE and healthcare in Saudi Arabia, and then I will conclude with a few remarks on the importance of automation in healthcare and what are some of the gaps we have. So digital health has been always, for example, in our region, has been always the biggest critical matter from a leadership perspective. That's why our leadership has been always focused on pushing the envelope when it comes to digitization. And now, the Web3 technologies are also invading the industries, the rigid and very traditional industries like healthcare, to try and ease the processing in it and try to automate the user experience. Healthcare has always been a lagging industry behind aviation, real estate, retail, F&B, especially in the area of automating a lot of the rigid and old school processes. And healthcare is a very heavily regulated industry, and the reliance of digital has become a critical matter, and in that circumstances has become a national security to digitize healthcare. So you can see a lot of countries after COVID now has declared that healthcare is a national security impactful sector, and hence the important focus on digitizing it. However, if you look at the healthcare and the complexity of healthcare, this slide shows you the different advents and the different angles of digitization, from consumer wearables to mobile apps to smartphone utilization to virtual assistants to telemedicine, and obviously in the hope to get personalized medicine, web-based programs, and moving into more email, text messaging, more interactive platforms. So again, that does not hide the fact that we have been very focused on digitizing healthcare, knowing the fact that regulation will always fall behind. Regulation will always be lagging behind innovation in healthcare. That's why we needed COVID-19. I mean, all our heart and our prayers go out to the victims and the first line of defense who actually stood by and supported fighting this important pandemic. But at the same time, some of the impacts or some of the results we had from COVID-19 is the over digitization need. So the critical need for digitally implementing platforms and solutions within healthcare. And that's why COVID-19 has exposed the vulnerability in healthcare system, from processes to people to systems. The pandemic was required to try and push and disrupt the delivery models, the operating models, bring in more investments, and then look at the gaps in capacity and innovation. So I wanted to start with this slide to show you the importance of this, of what we've gone through, and coming out of the pandemic with an important fact of life, that healthcare uh, um, is not an expense. It's an investment. Healthcare is an important investment for the economy, for the people, and for the sustainability of different nations. If you look at the leadership and how the leadership has actually looked at bringing digital innovation. Not only that, if you look at the private sector and the amount of consolidation that has happened in the digital health space, where you see insurance companies and pharmaceutical providers are joining their efforts to actually drive more disruption in healthcare. Big giants like Oracle acquiring one of the biggest electronic medical record companies in the region for in the world actually for $28 billion. And that shows the importance of all the consolidation that is happening in the digital health space. So what I'm trying to do is hover you from a 50,000 feet altitude to try and show you what's happening across the globe because of the complexity of healthcare. And looking at this slide shows you the different stakeholders that needs digital and needs automation, specifically when it comes to the processes and the lengthy workflows that actually results most of the time in unsatisfied user experience or unsatisfied patients and family members. That's why the most important part of why automation is so essential to the health economy, to drive cost effectiveness, to look at new operating models like universal health coverage, which is one of the biggest key questions that came out of COVID. Who pays for healthcare? How much is it important for us to automate the processes to understand the actual cost of healthcare and how to offset the rising expenses and expenditure in healthcare? And that's why I re-emphasize the fact that healthcare is not an expense, it's an investment. And that's why any penny that goes into healthcare reflects on longer life expectancy, better health prerogatives and healthcare processes, a better lifestyle, and healthy communities. So again, that's why sustainability is at the heart of automation, cost effectiveness at the heart of automating healthcare, and then driving more innovation and public health perspective. Specifically, as we tackle now, we prepare ourselves for any future pandemics. We want to become pandemic proof, and the importance of automation in improving communication and data flow between different stakeholders within the same nation or cross borders becomes an essentiality to our survivability in the future coming pandemics. God forbid. So, if you look at some of the projects and the programs that has been unfolded in this region, and all these acronyms that you see are all digital health projects that has been unleashed across the region for the last 10 years, but they've been accelerated in the last 3 years, and that shows you the effect of COVID, where now every automation is required in healthcare, whether it's automating your financial services integration platforms between hospitals and insurance companies. And we see national programs in Saudi and UAE, in Egypt, in Jordan, Oman, and India are actually pushing towards more automation and more digitization of the universal health coverage, right? You look at obviously digitizing hospitals, and that's why you see acronyms like HIS and EMR, Hospital Information System, Electronic Medical Record, Healthcare Information Repositories, or even national claims platforms. You will see a lot of these big programs happening across the Middle East, across West Asia, with huge focus on accelerating these digitizations, starting with financial services integration platforms, and then moving on to the biggest headache that healthcare has, which is integrating clinical data across different private and public sector facilities. So, if I give you a quick comparison on how the healthcare systems have been disrupted and innovated or disrupted to drive more innovation using automation, it drove the disruption at the heart of healthcare systems, right? Looking at the way healthcare is operated, the operating models of healthcare. In Saudi Arabia, for example, they have been pushing now into more decentralization. The framework that has been operated for the last 20, 30, 40 years in Saudi is a centralized ministry of health. However, with this, healthcare systems now are pushing towards more decentralization or clustering the healthcare regions into smaller, more manageable clusters and regions to allow more healthcare service provision. And imagine how much automation has been needed in that area. In Qatar, likewise, because of the organization of, for example, the World Cup that is happening in another 10 days or less, where we are looking at obviously the use of automation and technology to try and manage um, different programs, non-communicable disease, population health. Also, try to monitor the health of your audience and your crowd. Again, digital tools have been implemented heavily, and then the UAE, where they actually look at the trying to uh, solve the issue of high complexity by automating more and more solutions. Again, this shows you also that sometimes with less automation, ownership is not very clear. The more we automate and the more workflows and processes that we can push out of manual labor into more automation allows us to actually find and define the ownership matrix. And that's why if you come also to the fact that most of the healthcare systems in these three countries are actually reliant on foreign physicians and foreign clinicians, foreign workforce, it's very important to also use automation in the area of licensing, where one of the biggest gaps we found during COVID is the lack of physicians and doctors and nurses out there, and also the lack of data analysts, the lack of citizen developers and coders as well as that. So it's very important to understand the different perspectives of healthcare and how automation is helping us solve issues in governance, solve issues in operating models, and solve problems in the speed of acquiring talent and reinforcing our the gaps in workforces. And then finally, public health. One of the biggest issues is the surveillance and track and trace capabilities that health systems in this region and beyond needed to build, right? Because when you are actually developing, when you are fighting pandemics, one of the most important aspects is the fluidity of data. How can you manage and have access to real time data at all times? um, so if I take you to the next aspect where you deep dive into the digital aspects of those three countries, you look at the most important automation programs across Saudi Arabia, Qatar, and UAE, and you will always find that automating and unifying their claims management platforms is one of the biggest headaches every country will have. Also, clinical services integration and providing an interoperable platform to connect private sector hospitals and clinics with public sector hospitals and clinics. Again, a big headache. What we call an HIE, health information exchange. When you look at also the electronic medical record market, where a lot of big companies are actually diving into to automate hospital workforce and clinic workforce, we've seen some dominance by big companies like the likes of Cerner, InterSystems, and whatnot. These are companies that have been very well versed in automating hospital workflows, and their reliance on automation and actually innovating, going on top of their traditional platforms and trying to bring in more RPA, robotic platform automation, or robotic process automation, looking at, for example, processes like NLP, to try and top up their engines and their platforms to speed up and make it more resilient as we go into more pandemic prone economies in the near future. So that also required a lot of governance, a lot of privacy and data residency laws and processes. The hyper automation that has taken place in the healthcare perspective has opened up the need for also trying to put some sort of governing perspective framework specifically for the data misuse and the data management across healthcare. And then finally, innovating beyond that, right? Going beyond the traditional hospital information systems or traditional ERPs that you have at the back end with your healthcare facilities. So it's very important to also relate this to the expenditure, because as you hyper automate, you probably gonna put reserve a lot of budget to actually spend in the digitization of your healthcare sector. And that's why if you look at the expenditure in healthcare, Saudi Arabia is known to be one of the biggest healthcare spenders in the region, with the biggest budget across the six other countries, or from the other from the six countries in the GCC region. So it's very important to understand why is that. The population of Saudi Arabia is 40 million. The next biggest population after that is in the United Arab Emirates, and then you have Qatar, and then Kuwait. So it's very important to understand that the expenditure obviously follows the budgetary requirements. Oman has a big population, but again, their healthcare expenditure is ought to grow as well as their population is growing. And again, this statistics, by the way, is 2017. These numbers has grown up, where Saudi Arabia now still is the highest spender in healthcare. And this also brings us to another important perspective. There was a huge meeting during COVID-19 in August 2020. This meeting brought in these regional heads and regional representatives in the healthcare space to look at what should be the priorities of the next 5 years. And they have been declared 7 priorities. These priorities range from human intelligence, and this is mostly focused on decision making capabilities, decision support systems, and the requirement for automating more processes to help us in making the right decision with the minimum required data at the right time. And this also drives us to a second priority, the interoperability and the integration between the siloed health systems in the sector. And then finally, and thirdly, supporting the adoption of more artificial intelligence, which requires more machine learning algorithms and more automation. The lack of research and innovation in the healthcare sector also was highlighted as a priority to be invested in. We don't have enough talent or research or budget funds in the area of automation in healthcare or digitization in healthcare. Looking at obviously performing or focusing on performance in healthcare is another aspect that drives more effectiveness and efficiency in processing data and automating processes. Health data governance and the importance for building policies to safeguard the way we collect the data through automation. And then finally, communication and public health awareness. This is very aspect. And there has been a list of 9 recommendations that came out that showed the importance of digitization and automation in healthcare. um, so the other aspect is trying to deep dive in one health system to give you that perspective. The UAE is a very interesting use case, and I would love you to bear with me as I go through the slides. In the UAE, the focus has always been like the other two main countries that also drive healthcare expenditure and healthcare innovation. We have a varied or a variety, a vast, diverse demographic population in the UAE with over 200 nationalities. And this requires us to obviously build our healthcare service provision model to in a way that could actually cater for all these different demographics, and how automation can help us get closer to our patients and population. The next thing is looking at patient experience. Again, the healthcare sector still has a lot to learn from other sectors when it comes to improving user experience. The growing need for private sector to participate in the digitization and innovation. Another area that this industry has, which is actually a lot of the population move around for seeking healthcare services. The area of medical tourism and the importance of how personalized medical records could be shared across different borders, and how do you guard that. And then going into the area of care anywhere, or how you can actually share data across health systems. And then finally, the push towards more wellness and how people can use wellness wearables and wellness gadgets to actually preserve their health, as healthcare is one of the biggest sectors that always looks after catering for patients when it's already too late, when the patient is sick or diagnosed with a certain disease. So if you look at some of the huge projects and programs that are happening in Abu Dhabi, driving digital innovation through partnerships, and this is very key because the importance of digitization required regulators to go and partner with pharmaceutical companies. Pharma companies in healthcare are known to be highly excited and attracted to digital health and data, and that's why there's a lot of funding that is coming out of pharma into the digitization of clinical trials and whatnot. And that's why you'll see a lot of partnerships being performed between regulators and pharma and academia, by the way, where academia is actually pushing towards more research, with the data that has been accumulated or being accumulated. If you look at obviously the advent of Web3 in healthcare and how UAE is pushing to become the hub for Web3 technologies, the like of metaverse, VR, AR. Obviously, now with the slowness that is happening in crypto, the crisis that are happening in cryptocurrency, obviously there is a lot of regulation that will come up. I've just attended a conference called the Middle East Investment Conference, and all what they were talking about, the shock waves that has been sent when FTX was actually declared bankrupt, and all the crisis that came out of that. But again, they were still pushing. There was more innovation, more digital unique assets, the exploration in the areas of NFTs and digital assets. UAE has created a number of digital assets authorities, by the way, that has started looking at exploring that economy and how that will reflect on healthcare, because we are looking at using cryptocurrency in insurance payments, covering healthcare services. Also the metaverse, and what how can we unlock the economy of metaverse, and what we can do to actually open up the doors for people and companies to actually build more metaverse use cases into the healthcare sector. So another area, obviously, the creation of regulation and how regulation is trying to actually open up the door for more investments from Web3 capabilities, into Web3 capabilities, and how can that open up the doors for healthcare use cases and investments. And again, this is a big focal area that we are seeing in the UAE at the moment as we explore more and more technologies that could be modeled into healthcare. And you can see the focus in the last 6 months escalating through the number of meetings and publications and establishment of regulator authorities in this area. But that doesn't tell you, doesn't stop us from thinking about what should happen when we look at driving resilience in COVID. One of the biggest conferences that happened in January this year was Arab Health, and Arab Health is the biggest health technology gathering in the world. It happens every January, and the four major areas that came out of that conference is looking at investing more digitization in mental health, because that's one of the biggest headaches that has hit us because of the burnout and the the workforce workforce redundancy caused by behavioral health issues, the likes of depression, stress, and anxiety, that costed us all globally over $1 trillion loss of productivity. Digital operating rooms, and because operating rooms were the conventional and traditional way of making money in a hospital life until COVID happened, and that was completely annihilated. And hospitals have been made redundant when their operating rooms have closed, and that's what they started thinking about, digitizing one of the biggest money making areas in a hospital life cycle. And operating rooms and digitizing the surgeries is one of the biggest focal areas. Bedside imaging and connecting image repositories in the diagnostic world in healthcare, another huge focal point for digitization and automation. And then finally, the areas of female health tech, like for example, the area of fertility, reproductivity, and also female care, and how you can actually bring in digital automation and solutions into that area. Huge investment areas. These are the four areas that were highlighted by Arab Health as the 5-day conference concluded. But that brings us back again to what the UAE has been focused on, bringing in the new advents of stem cells research, genomics, and obviously building more research capabilities to try and bring automation alongside building more sustainable economies, sustainable healthcare economies in the region or in the UAE. So if you look at, and I'm sorry for this, if you look at the different laws that has come out, there are a number of major laws that came out of the UAE, especially the medical liability law that was established in 2016, and then the federal law for health data in the UAE that was established in 2019. That shows you that regulators are trying to catch up with the different automation programs that are happening nationally on a state level or privately in the private sector. Um, and these laws are are very essential, especially as we drive more consumer-centric digitization and value-based care, digital transformation, and as we completely move towards more disruptive operating models, it's very important to understand how automation is at the heart of it. Coming to the Saudi health system, and I'm gonna give you a bit of a taste of what happens in the Saudi as they prepare to compete to win the Expo 2030, and they've been already hosting Formula One events. Uh, Saudi is a huge healthcare system. The digitization in Saudi Arabia has become a focal and a national priority because it requires digital solutions and automation in every industry. Not only that, but specifically in healthcare. Healthcare in Saudi has been one of the biggest budgeted sectors in Saudi, and due to the fact that they're expecting the Saudi population to jump to around 80 million people by 2050. Don't forget, Saudi suffers from one of the biggest disease spread, the non-communicable lifestyle-related diseases, the likes of cardiovascular diseases, hypertension, diabetes, oncology, cancer, and whatnot. And don't forget the lack of workforce in Saudi Arabia, like other healthcare systems in the region, has also made it a paramount or a mandated priority to try and bring in more digitization, to try and speed up either talent acquisition and try to reduce the burnout on the existing workforce. But it's very important to understand the focus on a healthcare system that gets 14% or above that of the government spending goes into healthcare, and that's a lot of spending. Don't forget as well that the healthcare system in Saudi is going through a huge corporatization mandate, privatization mandate to bring in the insurance companies to help offset some of the expenditure, to bring in more decentralization and clustering frameworks and mechanisms to try and manage the provision of health services. And this by itself, meaning breaking off a huge sector that is regulated by the Ministry of Health of over 500,000 employees. And again, the Ministry of Health itself is a huge undertaking to try and manage over 300 hospitals and I think 2,500, 2 to 4,000 primary care centers, if I'm not wrong. So, and that's why a number of establishment has started getting into the healthcare sector. Governmental authorities like the Council for Healthcare Insurance or the National Unified Procurement Company to try and disrupt the way track and trace of drugs and the procurement of pharmaceutical products could be done in an automated platforms. Also, the likes of other entities like the Saudi FDA looking at utilizing fraud, waste, and abuse automated platforms to try and tackle the areas of counterfeit or expired drugs. So a lot of work and automation in the industry in healthcare of Saudi Arabia. And that's why if you look at the major reforms that are happening in Saudi, from privatization to transforming the healthcare sector into more manageable regional health sector or health driven system, it allows us to understand the importance of the growing need for digital health, especially in Saudi Arabia. The areas of wellness and preventative care is also driving a lot of the automation, the use of wearables and lifestyle gadgets to try and drive more healthy lifestyle, and obviously bringing in the advent of genomics and stem cell and bionic arms and bionic limbs has driven a lot of the digital requirements as the expenditure has been escalated. And again, obviously, new programs and giga projects are appearing in Saudi Arabia, the likes of NEOM and other programs that also require building the latest and greatest healthcare systems. And this brings me to an important strategy that was launched in Saudi Arabia. It's called the ICT Sector Strategy 2030, that looks at the emerging technologies and the importance of, for example, robotics or VR, AR, Web3 technologies to try and embed that as we move from traditional IT solution into more advanced technologies. The infrastructure itself, the requirement to update and upgrade your infrastructure to match the needs of the future. And that's why if you look at that healthcare or that digital strategy that embeds itself in the number of sectors, including healthcare, and the importance of smart city and smart infrastructure, it shows the importance of automation in Saudi Arabia. So in conclusion, as I try to prove the fact that healthcare is driving a lot of the automation across the use cases that I shared with you, it's very important to know that healthcare in general has a lot of gaps, from patient journey all the way to data flow, to actually bring in private-public partnership to drive some of the disruption happening in the care service delivery models. And the need for hyper automating, the likes of NLP, the likes of hyper automation, RPAs, and whatnot. The need for Web3 as well to come in and support the automation process mining, artificial intelligence, and whatnot. And that's why there is a huge shift as we get into more trends, deep learning, quantum computing, that brings in more capabilities into the area of digitization of healthcare. Certainly, not only hospitals and clinics will see that disruption. Pharma life sciences is playing a big part. New entrants, the likes of telecom companies, are coming into healthcare. Technology companies are actually investing a lot in healthcare as well. You will see also financial services organizations coming into healthcare and bringing a lot of investments. And that is good news, because as we said again and again, healthcare is not an expense, it's an investment. And that's why you will see, as we drive more quality healthcare, what we call the value-based care, you will see more and more technologies coming in, from quantum computing, edge computing, to population health and precision medicine technologies, to data decision science and AI, and beyond that. That's why one of the slides that I like to show is the this slide. It shows you the complexity of a facility. A healthcare facility could be as complex as what you see in front of you, with so many systems in at every layer of the hospital, from back end to infrastructure to front end, between different departments, from procurement to finance to admin and patient services, to medical doctors, to laboratories, to pharmacies, to radiology department. A lot of technologies that can come out. And again, what we are trying to do is move now to the next step, the interconnectivity of these systems within a facility, and then moving beyond the facility. 20%, only 10 to 20% of the data of the patient is collected inside the hospital using these systems. Most of the patient data sits outside the hospitals. We haven't even spoken about social determinants of health and the data collected by wearables and whatnot. We don't talk about even the employment data, the behavioral health data, the family related data, schooling data, and whatnot. So that shows you the advent and the need and the hunger for more and more automation. That brings me to a beautiful report that was published in 2020 by Deloitte. And by the way, there is a later version that was published in 2022. This canvas shows you where are the trends and the huge aspects of technology that will be forecasted. By the way, this is before COVID. So if you ask me now, would this be changed after COVID? I will say absolutely. You're gonna start seeing more emerging technologies being pushed in, and some of those future technologies are actually are becoming more and more evident. The likes of, for example, artificial sensing skin or quantum computing. A lot of people are talking about the technologies of quantum computing, nanotechnology. So hyper automation, but in bringing things like citizen development, no code, low code, talking about, for example, marrying that computing advancements into biometric and bionic capabilities, the likes of hyper automation, and how this will actually bring in more advances in technologies, the use of 5G. How is that being now? How is that enabling us in healthcare and beyond healthcare into advancing our VR and AR capabilities? So again, this is a fantastic canvas that you look at, and I'll be more than happy to share with you the latest version from the Deloitte report that takes you even further. And again, it's through the meetings and the conferences that we have been attending and being exposed to, you're seeing that every stakeholder in healthcare is talking about digital transformation or digitization or automation, from dental to pharma to healthcare, all the way across the globe, and the different conferences that are happening, especially in the area of digitization and automation. I'd love to invite you to these conferences, and I hope to see you very soon in Dubai and beyond. And also point you to the right gatherings where you can actually come in and share your experiences, find business partners, and collaborate in the area of digitizing health economics, or the area of coding and managing health information processes, or the areas of obviously automating medical education and skilling up of the healthcare workforce. With this, I want to thank you dearly for allowing me to talk to you today. Please connect with me. I'm on LinkedIn. I'm available on LinkedIn mostly, and beyond. And be more than happy to share with you also the slides and the reports that were referenced in those slides.
Thanks so much, Dr.
Thank you.
Mazin. This was a very excellent presentation in which I actually learned a lot myself. I think your title is very adequately chosen: the good, the bad, and the future. I think it kind of is a nice way to discuss all the different topics that you addressed in the presentation as well. While you were talking, I saw a lot of questions coming in, and you can see some on the right. We only have a few minutes left, so I'm going to try to be picking a couple which I think are going to be very useful for the entire audience, because we don't have time to answer all of them. Going to get started with one of the first questions that came in. Let me project it on the screen, and that is: how does the Dubai Health Authority deal with the machine learning and automation when it comes towards patient privacy? Any advice on best practices?
Sure. There is actually at the moment there is the healthcare data law, ICT data law, which is a federal law that gets used in Dubai Health Authority for making sure that all the solutions and softwares that gets used in healthcare facilities need to abide by. For example, moving data out of the country, there is an addendum that allows a bit of anonymization for ML algorithms to be used outside the borders of the UAE. So there is a process. It's still maturing up. There is a policy that has been established in advanced healthcare systems like US FDA, where you have to register your ML algorithm as a software, as a device, they call it, right? We haven't yet implemented this on a federal level. It's coming in at the end of quarter 4 this year, where now all healthcare solutions, ML algorithms, AI algorithms have to be compliant with the checklist. But at the moment, you probably need to work through a partner, find a use case, take it to the Dubai Health Authority to try and check the requirements from a health ICT data law. More than happy to share the ICT data law policy for now. And then once the new ML algorithm compliance law policy comes out of the Ministry of Health and Prevention, which is the federal arm, then the state level authority will have to comply with that as well. I hope that answers
Yeah,
it.
I think it does, and I also think that Dubai, as a government, is then quite far ahead already, making these kinds of laws available. I see, or at least from what the work that I've been doing here across Southeast Asia, that this is a topic that many organizations are struggling with in terms of what is the ethical divide between, classifiers which very easily can put people into certain boxes, or can be of tremendous use for insurance companies, etc. Where is the line between that?
Sure,
Good. So yeah, if you would be able
absolutely,
to share those guidelines with the rest of the group a little bit later, I think that would be absolutely great.
absolutely. I'll be more than
Good.
happy.
Another question, which I think is quite related, I think this was the part where you talked about the regulation, that these questions came in, is should there be regulation for automation? So that's, I think, a slightly different question than the one that we had before. Any thoughts on that? Should there be regulations for automation, or is that more clear cut?
So that's a very good question. And again, I mean, regulation for automation might, especially in healthcare, might be a requirement, because again, the result of this automation is is a process that would either that might harm or might cause some harm to a patient. So you need to make sure that you build some sort of clinical governance around this automation, whether you actually build it on the code that gets, or the process that gets automated, or the outcome of the process that gets automated. It differs, but again, you don't want to over regulate, because then you're pushing all the innovation out of the
Yeah.
window. You have to play a fine line between regulating code, software, and automation, and regulating the outcome of that. So it's a very fine line. For me, so far, I've been seeing Saudi FDA, like the US FDA, and the UAE is actually pushing towards more regulation for software as a medical device, which will encompass ML algorithm, AI algorithm, allow them to go through a checklist, as the case in the US. But again, how lenient is this regulation? Does it actually cover complete automation, no code, low code platforms, citizen development platforms that are used to automate processes within healthcare? That's another
Yeah,
question.
that's a very good question as well. I like the term that you're using, clinical governance. I did not hear that before. That might be something to explore a little bit deeper, and I might be something that I'm going to invite you back over next
Sure,
time around. Good.
sure,
I know that there's
absolutely.
still some questions left, but unfortunately, we're getting out of the time, and our next speakers are waiting already for the next session. So
Sure.
unfortunately, we slowly need to get towards an end for the session today. Dr. Mazin, I would sincerely like to thank you for being with us. I know that this was your first time during Automation Days. I hope you enjoyed it as well. And
Absolutely.
I also note that you recently became a father again, so all the best
Thank
at
you.
home. Thanks so much for taking the
Thank you.
time to be with us today. It's truly greatly appreciated.
Much appreciated. And I want to thank you for moderating and facilitating this so smoothly. I left my LinkedIn, so for anybody who wants to get in, and I'm more than happy to participate and share the podium with you in the near future.
Absolutely. I have some trips planned to your part of the world in the beginning of next year, so I'm quite sure we're going to meet up again.
Absolutely. Looking forward to that.
Good. For everyone else, in 10 minutes from now, we're already going to start with the next sessions. And again, you're going to need to make a very difficult choice. But the good news is it's your last difficult choice, because this will be the last track sessions, after which we're going to go towards the final centralized session. Up and coming, we have Floor van der Wind, who is going to talk about low code automation and workflows for every organization, representing OutSystems. In track number 2, we have Alan Liebenthal from BMC, who's going to be talking about accelerating data-driven outcomes through automation, data ops, cloud, and workflow orchestration. And in track number 3, we're going to be learning from Tim Mossold from Smart RPA around overcoming operational challenges and barriers to scale in large automation projects. So again, 3 very interesting sessions. So take your pick, and we will see you in the next up and coming sessions. Thanks so much for your time, and we look forward to seeing you soon.